This is an installment of Staying Safe in the Hospital, a guide for older adults and their families. We are here to talk to you about dysphagia.
Hello, my name is Debbie Ford. I'm a nurse who worked at the University of Colorado Hospital Acute Care for the Elderly Unit.
And I'm Kelsey White, a nurse who works on the acute care of the elderly unit at University of Colorado Hospital.
Let me start by sharing a story of one of my patients. Janet was an 80-year-old woman admitted to the hospital with pneumonia. Normally, she enjoyed walking and visiting friends in her assisted living. 2 weeks before admission, she was feeling weak, sitting down or lying down most of the time. She lost weight. During meals, she was exhausted, coughing frequently, and her voice sounded wet. She often wiped excess saliva from her mouth. In the hospital, nursing recognized the signs of dysphagia. She was seen by a speech therapist. A swallow study was done. The medical team made a diagnosis of dysphagia, or difficulty swallowing. A treatment plan was put in place, and gradually Janet improved.
When we swallow, our tongue works to push food and liquid from the mouth to the throat as we eat and drink. It then passes to a muscular tube in the throat called the esophagus and moves down into the stomach. The esophagus muscles tighten and relax like a wave-like motion to keep food and liquid traveling downward. When dysphagia occurs, food and liquid has a hard time passing down to the esophagus. If you or a loved one has dysphagia, you may feel chest pressure or pain when swallowing, need extra effort or time to chew or swallow, notice food getting stuck in your throat or pocketing in your cheeks, vomit or bring food or liquid out of your nose after you eat or drink, or feel very tired and lose weight. You may also experience choking, coughing, and difficulty breathing when you swallow. This can happen when the muscles in your throat aren't working normally and you breathe unwanted food or liquid into the airway or lungs. This is called aspiration. You may experience too much saliva, feel congested, hear a wheezing sound after or during eating, have a fever or pneumonia that occurs over and over again. And some people have no symptoms at all. You may hear the healthcare workers call this silent aspiration. When a person has dysphagia, aspiration is always a risk we are closely watching for.
Dysphagia can be caused by many things. The speech and language pathologist and the medical team will work to find out what the cause of dysphagia is for you or your loved one. The team will look for weakness and other problems with the muscles in your mouth, throat, and esophagus. They will consider problems inside the esophagus, such as thickening and narrowing, as well as ulcers, irritation, infection, swelling, cancer, problems with the nerves or the brain being able to send signals to you for you to swallow.
Dysphagia and aspiration can be scary. Know that the healthcare team will work quickly to identify dysphagia and its cause. If you or a loved one are showing signs of dysphagia, expect the nurse to do a bedside swallow test. This is when we will ask you about your swallowing experience and likely ask you to drink water as we examine you. If nursing has concerns, you will likely be visited by a speech and language pathologist who will complete a more thorough exam where they will ask you to swallow a series of substances ranging from water, soft food, or even regular foods as they look at your mouth, throat, and breathing. If the team is concerned you have dysphagia, further tests may be ordered to evaluate the cause and severity. In some cases, the treatment of dysphagia may include addressing the cause of dysphagia, and this may include surgical options. Whatever the cause, our main goal is to prevent aspiration. Treatments may include changes to your diet where you may need to drink liquids of a certain thickness, food of a different texture, deliver medications in a special way, change your position when you eat, or learn exercises to help you swallow. In severe cases of dysphagia, eating or drinking may not be safe at all, and a feeding tube may be offered for a short time.
The care team in the hospital will teach you and your loved ones what aspiration precautions are needed for your situation. Precautions may be temporary or they could be needed for a long time, even after leaving the hospital. Families can make a big impact when it comes to helping your loved one follow the instructions on how to eat safely and follow diet recommendations. It may be necessary to eat blended or chopped foods. Liquids may need to be thickened. You can encourage your loved one to eat slowly in a relaxed setting, not to talk while they're eating, avoid distractions while eating. Take small bites, chew slowly and thoroughly. Changing between solid food and liquids may also help your swallowing. Sit fully upright during and for 30 minutes after meals. Get in a chair if you're able. These can help reduce the risk for aspiration. Change can be hard, especially something as personal as the food we enjoy. It's not uncommon for patients to feel frustrated with dietary restrictions. Being positive and offering encouragement can help motivate your loved one to cope with change. If you notice any symptoms of aspiration while your loved one is eating or drinking, notify the care team at once. Coughing, choking, or wheezing during or right after eating, excess saliva, shortness of breath or fatigue while eating, a wet sounding voice during or after eating or drinking, fever 30 to 60 minutes after eating. If you have concerns or questions about any aspect of your loved one's care, talk to a team member.
So, we have now talked about one of the most common, yet least talked about problems that happen to older adults in the hospital: dysphagia, what it is, how to recognize it, and what you can do to help.